Hi to everyone, and welcome to Feb's clinical case. This month I'm going to be talking about a condition that affects the eye called glaucoma. So in a very similar format to the previous clinical cases that I've presented, I'll talk very briefly about maybe some things you already know about the eye or should be expected to know maybe as a basic background to this talk. And then we'll go on to talk about the kind of causes and symptoms, the ways in which glaucoma is investigated in clinical settings. We'll talk about how it can be treated, how it can be managed to prevent more serious complications, and then at the end I'll talk about the main takeaway from this case. Okay, so again, perhaps some of you have a good understanding of the eye and the anatomy of the eye, maybe some of you less, but it would be helpful if, as a background to this talk, there was some understanding of the basic anatomy, and if not the anatomy, then at least the function of the eyes, and that should be fairly obvious in terms of facilitating vision. And also maybe some understanding that there are diseases of the eye, and diseases of the eye can interrupt or affect the functions. So, for example, diseases of the eye can cause redness, they can cause pain, and in very, very serious cases, they can even cause blindness, loss of vision. And that is one of the serious complications of glaucoma. So I've already said a couple of times that this month's talk is going to be about glaucoma, so it would probably be useful to start by having an understanding of what exactly it is, even if only briefly and in the most basic terms. So what it is it's an eye condition in which there is an increase in the amount of fluid that builds up in the eye. So if you think about your eye, obviously it's not completely dry. It's lubricated, there's fluid in there, and in glaucoma what happens is the amount of fluid that's in there accumulates, it builds up. Because the amount of fluid is increasing, that then increases the pressure inside the eye, what we call the intraocular pressure, the pressure in the eye. And when that pressure goes up, that can damage the optic nerve, which is responsible for your vision, for you seeing, and that can then cause some of these serious symptoms like loss of vision and blindness. So increase in fluid, causing increase in pressure, causing damage to the nerve, causing potentially loss of vision and blindness. Now, there are two main types of glaucoma. There is primary open angle closure glaucoma, and in primary open angle closure glaucoma, it's more of a chronic condition. The fluid is building up in the eye more slowly over time. Okay, and with acute angle closure glaucoma, which is the other kind, because it's acute, it's happening much more suddenly. So suddenly the pressure in the eye rapidly increases, and as you can probably imagine, that is more of an emergency because it's suddenly going up. It needs to be treated and managed very promptly in order to prevent these more serious complications. So you can think of one as more chronic and one as more immediate and urgent. In terms of the causes of glaucoma, of course, there are many different causes, but I've listed some of the key ones there on the slide. So as you increase in age, particularly as you get into your sort of 70s, glaucoma becomes much more common. Ethnicity is also a risk factor. So there is evidence to indicate that people of Afro-Caribbean background or from an Asian background are more at risk of glaucoma. Family history is another big one. So you'll often see if you go for an eye exam, they might ask you if anyone in your family has a history of eye disease like glaucoma because there is a familial connection there. Being short-sighted, sometimes being long-sighted can affect the risk, can increase the risk of developing glaucoma later in life, and diabetes is also a risk factor. Okay, so what are the key symptoms of glaucoma? If you see a patient, what might they present with that might make you worried that they have this condition? So I've split this up between eye symptoms and just other bodily symptoms. The main eye symptoms to look out for, obviously pain. The pressure is increasing in your eye. You're going to feel this pain in there. Your eye might be red. And you might be complaining about having blurred vision. You might not be able to see from the sides of your eye. You might feel like, there's an increasing amount of loss of vision. So those are some of the key eye symptoms to look out for. And in terms of other symptoms, it's very common with glaucoma for patients to experience nausea and vomiting. They might feel nauseous. They might also have a headache. So these are some of the key things to look out for in terms of symptoms. Okay, so someone's come in and you suspect that they might potentially have glaucoma. How would you go about investigating them? So one thing you can do, and the most basic and important step to start with, is a fundoscopy, which is an exam in which a light is shone in the eye using an ophthalmoscope. And that might show you some cupping of the optic disc, which is very indicative of glaucoma. For this stage, it's perhaps not too important to worry too much about what cupping means and what it looks like, but that is something that when you begin your medical studies will be explained further. But at this point, it's useful to know that you can do like a basic eye exam, and there'll be these characteristic signs of glaucoma. There are a whole host of other things you can also do. You can do a slit lamp exam. This is the one where you rest your chin. You might have seen it. You might rest your chin down against this machine and put your forehead against the other part of the machine. And again, it can look inside the eye. Tonometry. This is a machine that can measure the amount of pressure in your eye. So this is actually considered to be the gold standard investigation for measuring that intraocular pressure. Because if that pressure in the eye is increasing, again, you're thinking this is probably very likely glaucoma. You can also do other things like assessing the patient's visual fields to see if there is a loss of vision and where exactly that loss of vision is. Okay, so if you've confirmed your clinical suspicion that the patient has glaucoma, how would you treat them? So one of the most important things to do is to refer them very promptly, very quickly, very urgently to ophthalmology, so the eye doctors, effectively. And that's especially important for angle closure glaucoma. It has to be treated immediately, so you want to refer them. They're going to be in a lot of pain, so you want to give them pain medication. You want to give them analgesia to help manage and relieve some of that pain they'll be experiencing. And if you think that glaucoma is a condition in which there is an increase in fluid causing an increase in pressure in the eye, there's two main ways to alleviate that through medication. One way is to reduce the amount of fluid that's being produced. So you can give this medication called acetazolamide, and what acetazolamide does is it reduces the amount of fluid that's produced in the eye. But there's another way to solve the problem, and that's to increase the amount of fluid that's being drained from the eye. So you can stop it being produced, but you can also increase the amount of drainage from the eye. And this drainage mechanism is what pilocarpine does. It increases the amount of fluid that's drained from the eye. So these two medications you can see working hand in hand. One tries to reduce the amount of fluid being produced, and the other one increasing the amount of fluid being drained. Now, if the medication is not useful or doesn't help to relieve the symptoms, the main way in which you'd solve it is through surgery. So what you can do is this procedure called an iridotomy, where a laser is used to create a small hole in the eye, in the iris, and that can facilitate drainage of the fluid and relieve that increased pressure in the eye. Okay, so the main takeaway from this case, obviously there's a few different things you can take away in terms of facts, in terms of knowledge, but the main kind of principle I'd want you to take away is the importance of recognizing key symptoms and signs early in order to prevent serious complications. Because if you're able to detect, if you're able to pick up on glaucoma early on, you can treat it, you can manage it, and you can prevent these more serious complications like blindness that we've spoken about from coming about. So it's very important to do a proper clinical examination, take a proper history, do the investigations, pick the correct investigations in order for you to pick up on these diagnoses as early as possible and treat them and manage them in order to prevent really serious complications. And that concludes this month's talk. Hope you found it interesting and engaging, and hope you learned something new. And I look forward to presenting again in a later month. Thank you.